Bismillah ar-Rahman ar-Rahim. Our lecture is Anatomy of the Larynx. The larynx projects forwards in the median part of the front of the neck, from the root of the tongue to the trachea, opposite the third to sixth cervical vertebrae. The upper end opens into the laryngopharynx by the laryngeal inlet, while its lower part is continuous with the trachea at the level of the sixth cervical vertebra. It consists of a framework of cartilage connected by ligaments and membranes and lined by mucous membrane and moved by muscles. We'll start by the cartilage of the larynx. The larynx had three large unpaired single cartilage, including thyroid, cricoid, and epiglottis, and three small paired cartilage, including arytenoid, corniculate, and cuneiform. The thyroid cartilage. It looks like an open book formed of two thyroid alae that meet in the midline, forming an angle of about 90 degrees in men and 120 degrees in women. The posterior angle of the ala is elongated, forming the superior thyroid cornu. The posterior angle of the ala is elongating, forming the inferior thyroid cornu. The epiglottis is a leaf-like sheet of elastic fibrocartilage. The lower narrow part, the petiole, is attached to the posterior surface of the thyroid ala at their junction just above the anterior commissure. The anterior surface is separated from the hyoid and thyrohyoid membrane by the pre-epiglottic space. The cricoid cartilage. This is the only complete ring in the respiratory tract. It resembles signet ring, having narrow anterior arch and broad posterior lamina. The arytenoid cartilage, it resembles three-sided pyramids. The base articulates with the cricoid cartilage and has two processes, vocal process and muscular process, and three surfaces, medial and posterior and anterolateral surface, and the apex articulates with the corniculate cartilage. The corniculate cartilage is small cartilage that articulates with the apex of the arytenoid. The cuneiform cartilage is small and embedded in the area epiglottic folds. Regarding the joints of the larynx, we have two joints, the cricoarytenoid joint and the cricothyroid joint. The cricoarytenoid joint, this is the most important one. It is the most important joint in life because it's responsible for opening and closure of the vocal cords. It lies between the base of the arytenoid and the upper border of the cricoid lamina. It is synovial capsular pivot joint, moved horizontally like a door around the vertical axis, resulting in rotatory movement, abduction and adduction, as well as sliding movement. The cricothyroid joint lies between the anterior surface of the inferior thyroid cornu and the facet of the cricoid cartilage at the junction of its arch and lamina. It is synovial capsular hinge joint that moves vertically up and down around the horizontal axis. The mucosa of the larynx. The laryngeal mucosa is respiratory mucosa, except at the vocal folds and laryngeal inlet, where it is non-keratinized stratified squamous epithelium. The larynx space is a loose area of connective tissue between the vocal fold epithelium and the vocal ligament. It allows vibration of the mucosa on the ligament for voice production. Laryngeal folds. They are area epiglottic fold between the apex of arytenoid and the upper free part of the epiglottis. The ventricular folds between the lower part of the epiglottis, the petiole, and the middle part of the anterolateral surface of the arytenoid cartilage, and the vocal folds between the anterior thyroid angle and the vocal process of the arytenoid. Laryngeal ligaments and membranes. Ligaments inside each fold, intrinsic ligaments, membranes, and extrinsic ligaments, membranes. Ligaments inside each fold, the area epiglottic fold, the vocal and ventricular fold. Intrinsic ligaments, membranes are quadrangular membrane that connect the area epiglottic ligament with the ventricular ligament, and the triangular membrane, the cricovocal membrane that connects vocal ligament with the upper border of the cricoid cartilage. The extrinsic ligaments or membranes are the hyoepiglottic ligament, the thyrohyoid membrane, the cricothyroid ligament, the thyroepiglottic ligament, and the cricotracheal ligament. The laryngeal muscles. They are intrinsic muscles, abductor, which is posterior cricoarytenoid, and adductor, the thyroarytenoid, lateral cricoarytenoid, transverse arytenoid, and tensors, the cricothyroid, which is tensor and has slight adductor action and only intrinsic muscle supplied by superior laryngeal nerve. The extrinsic muscles are depressors of the larynx, which are infrahyoid group of muscles, and elevators of the larynx, which are the suprahyoid group of muscles. The interior of the larynx. The interior of the larynx shows the laryngeal inlet, the supraglottic, the glottic, and the subglottic areas. The laryngeal inlet is bounded by the epiglottis anteriorly, the arytenoids posteriorly, and the aryepiglottic folds laterally. The supraglottic region includes the epiglottis, the vestibule, which lies above the ventricular folds, the ventricles, which is the space between the vocal folds and the ventricular ones. The glottic region extends from the upper surface of the vocal folds to 10 mm of the under surface of the vocal folds. It is formed of vocal folds, which is the true vocal cord, the anterior commissure, and the posterior commissure. The subglottic area extends from the inferior limit of the glottic region to the lower border of the cricoid cartilage. The nerve supply for the larynx is the vagus nerve, by superior laryngeal nerve, which divides into two branches, external motor branch that supply the cricothyroid muscle, and the internal sensory branch that pierces the thyroid membrane to carry sensation from the supraglottic region, and the recurrent laryngeal nerve, or the inferior laryngeal nerve, which supply all intrinsic laryngeal muscles except the cricothyroid muscle and carries sensation from glottic and subglottic areas. The left recurrent laryngeal nerve has longer course as it descends in the mediastinum and turns around the aortic arch and ascends up to the neck between the esophagus and the trachea to reach its termination in the larynx. The right recurrent laryngeal nerve turns around the first part of subclavian artery to ascend up between the esophagus and the trachea to its termination in the larynx. The blood supply is from superior laryngeal artery, which is a branch from the superior thyroid artery, and the inferior laryngeal artery, which is a branch from the inferior thyroid artery. The lymphatic drainage. The supraglottic region drains into the upper deep cervical and pre-epiglottic lymph nodes. The glottic region has minimal or no lymph drainage, and the subglottic region passes to the lower deep cervical, pre-laryngeal, and paratracheal lymph nodes. The functions of the larynx. First function is the protection of the lower air passage. This is the most important function. It has several mechanisms involved, including closure of the laryngeal inlet during swallowing, closure of the vocal folds, automatic arrest of the respiration, and cough reflex. The second function is phonation, which means production of voice by vibration of the mucosa of the adducted vocal folds during expiration, and resonance of voice in the supraglottic region. The next function is the respiration, by reflex adjustment of the vocal folds, the glottis, the abduction during inspiration, and the adduction during expiration. Examination of the larynx. Inspection for position, whether shifted to one side, would move with deglutition, dilated veins, or skin scar. Palpation for tenderness and laryngeal click, which is normally elicited due to moving of the cricoid cartilage on the vertebral column from side to side, and this is called Moore's sign. Palpation of the neck for cervical lymph nodes for thyroid gland and trachea. Indirect laryngoscopy. This examination is conducted by a warm laryngeal mirror, and rigid laryngoscopy under general anesthesia for examination by microscope for magnification. This photo shows the indirect laryngoscopy using a laryngeal mirror, and this is the rigid telescope 70 degree, and this is the rigid laryngoscope.